Efficiency Unlocked is hosted by two tech-savvy physicians and dear friends of mine, Drs. Adam Karu and Dale Gold, who are experts in using technology to automate routine tasks and increase efficiency in everyday and business life. Let's see what they have for us today.
And there's a really important balance. I get it as a primary care doc that you want to have a relationship with the patient. You want to know when there's a problem, but our current system is not scalable. And all these people who talk about, we just need to decrease the panel sizes are living in a fantasy world. We have such access issues. We've got to do what every other industry has done and figure out how to tech enable, and team enable the most valuable people in the system, which right now are primary care doctors.
Welcome to this week's episode. I'm pleased to have Lyle Berkowitz as our guest. Lyle is a primary care physician, health system executive, serial entrepreneur, digital health consultant, and angel investor. He's the founder and CEO of KeyCare, a virtual care company with a mission to create tech-empowered virtual care teams that support, strengthen, and amplify our nation's health systems. In this episode, we'll talk about KeyCare's model, how virtual care can improve efficiency and quality of care, and how to automate and delegate the routine, repeatable, and rules-based care that are drowning doctors. We're super happy to have you this week on the show, Lyle, and I hope all the listeners enjoyed this conversation. Awesome. Welcome to Efficiency Unlocked, Nerd Tested, MD Approved. As you just heard, I'm super excited to have Dr. Lyle here from KeyCare and many other things in his past, but we're happy to have you on the guest, Lyle. Welcome.
Hey, thanks, Adam. Glad to be here talking to a fellow doctor who's interested in improving the system.
Yes, obviously a clear passion I think we both share. Can you start by just sharing a little bit about your past and kind of your origin? Because I think you have a very interesting history coming from kind of clinical care and health system to several others to where you've ultimately landed on your most recent venture with KeyCare. Do you mind sharing some of that backstory with the listeners?
Yeah, So the super shortcut is I trained as an engineer undergrad, became a doctor, a primary care physician and health system executive and an entrepreneur. But more specifically, I was a biomedical engineer. Sort of knew I probably wanted to go to med school, was really interested in computers and was able to sort of meld those two things in early in my career and trained a bit in informatics, IT, et cetera, and sort of self-taught in a lot of computer work. And, this was late 80s, early 90s. So I was the only doctor in my group organization who was interested in this stuff. And so that made it easy to sort of progress. And when I trained and did my residency then at Northwestern, I joined a newly formed primary care group and became the medical director of information technology, again, mid-90s at this point. And at that time, it just meant trying to get doctors to even use a computer for anything. So I learned early about physician adoption strategies and the importance of efficiency, something we both share a love of. And I was working on paper-based efficiency, computer efficiency, et cetera. We were not ready for an EMR, so I actually, early in my career, became chief medical officer of an EMR company that was based in Chicago, and I did that part-time while I was a primary care doctor. And eventually wound up over 20 plus years at Northwestern working as a PCP, building up my own practice. Our group became the largest primary care group in the city. I was a medical director of IT for the group, and eventually, in that sort of an early version of CMIO, eventually we wound up rolling out EMRs, and I melded and evolved my role to be the director of innovation, first for the group, eventually for the healthcare system. And so I had a really fun time blending this information technology understanding and experience with learning about innovation techniques and melding them together. And along the way, I somehow managed to be involved in a couple dozen companies as a, advisor, sometimes executive, and starting my own companies as well. started a couple companies, probably the most well-known being HealthFinch, which was in the workflow automation space, which did what we love, which took physician work and automated it and took it away from doctors. We focused on refills, and so we said, why don't we just process the refill using rules-based technology and delegate it to a nurse or an MA and take it off the doctor's plate, and that worked really well. And then eventually I left Northwestern in late 2017 and joined MD Live, one of the big telehealth companies, was the chief medical officer and EVP of product strategy, and so really got a really good understanding of national telehealth companies as well as fast-growing businesses as an operator, and we scaled that up. They eventually sold to Cigna, and I did some interesting consulting, worked more with HealthFinch. That sold to Health Catalyst, sort of retired for a minute, but eventually came back and started KeyCare, which sort of blended everything I know.
Yeah.
Right? It blended, everything about virtual care, using Epic, which I've had a long relationship with because of Northwestern and HealthFinch, and using sort of my efficiency, workflow automation ideas, and primary care background, understanding of health systems, and blended all that together to come up with that company.
Awesome. Can you share with some listeners, because I think some listeners on the show are technical or physicians, some are not, or just some, I'll just say our patients, are interested in this technology from the patient side. But can you explain just like a little bit about how KeyCare kind of functionally works? You mentioned it's based on Epic's platform, the EMR, but can you tell a little bit about how that works?
Yeah, so KeyCare is a new type of virtual care company, but really, think about it from a health system perspective. We are a national virtual care group, and we use Epic as our EMR. We are part of the Epic ecosystem, so we are the only virtual care group that has our own instance of Epic, and we staff it with physicians and other providers, and we create solutions like urgent care, primary care, specialty care that we can help take care of. But rather than going direct to consumers, we actually partner with other health systems, usually Epic-based systems, who essentially look at us as the very basic a workforce augmentation partner, someone they can send patients to, and we'll take care of them virtually because their staff is focused on office-based care or just supply-demand mismatch. But because we're on Epic and they're on Epic, when we take care of a patient, we see all of their records, and vice versa. When we finish a visit, sign a note, everything gets sent back to the health system. So there's data interoperability, which is really important for quality and efficiency perspective. But also there's what we call workflow interoperability, meaning from a patient perspective, they can go to their health system, sign into their MyChart, the Epic portal, and make an appointment with us without having to leave that portal. So it's a very seamless, integrated experience, very coordinated, so very convenient and efficient for the patient. And again, for our doctors, there's everything comes to them automatically. They don't have to go searching for it. So we've really tried to take advantage of the Epic to Epic interoperability, data, scheduling, referrals, orders, messaging. We can truly partner to a health system and then offer them what we do at scale, because they can't necessarily easily spin up a 50-state, 24/7, virtual care group. We're able to do that and then offer it to multiple health systems all at the same time.
Yeah, no, that's great. I mean, I think from a consumer perspective, I think it's so nice that someone that's tied to a health system maybe has their PCP there or gets other care done at that system can still go through the normal pathway that they're used to, like you mentioned, going through the portal and then having this as being an option. So it looks to them like it's this nice partnership. I think that's really important for patients, because I think right now there's a sea of all those digital health companies out there, that are, many of them are very narrow, and just offering, hair loss treatment or impotence treatment or maybe a very focused women's health issue. But I think it's nice that.
as a doctor, right, it worries me to have these isolated groups out there because patients may get some type of diagnosis and treatment in a vacuum. So it can sit. It bothers us, but more. What is wonderful is that patients are now aware of it. We've asked patients. We've done some sort of anonymous surveys, and we've asked them first of all, do you want to do virtual care for routine issues, right? Do you prefer it over office-based care? And a lot of patients now prefer it. And a lot of patients will say, well, whoever can get me in easier. And then maybe another 30% actually prefer going to the office, which is all fine. But then we also ask them, do you understand and how important is it that you go to someone who knows who you are, that's connected to your primary care doctor? And the majority of patients also understand and want that. So they want it. The issue is the reason we're seeing a decrease in virtual care after COVID is not because patients want to all come back to the office. It's because doctors want to go back to the office. And so what I'll call the officeologists, right? They're focused and optimized on the office, which I get. I was an officeologist. It was really nice. I come in, my coffee is ready, my patients are going to be prepped and ready for me in the room. But patients actually these days often prefer using a virtual care type of offering. Particularly for routine stuff, they're fine seeing a partner. They don't need to see their primary care doctor, but they do want it to be connected. So I appreciate that. Well, as doctors, we understand that. Patients understand it too.
Yeah, no, it's super interesting because, I work in obviously an integrated system for my day job, and it. We have interesting data around patients in our system, that there's clear data that shows that when people have like a dedicated PCP that they, like and have stayed with, they're extremely sticky, to our system. But then on the flip side, there's a portion of that exact same population and demographic that could care less about having a PCP, and they don't have any health problems, or when they do, they just want, something that's quick, accessible, in their system. So I think, just thinking about, the concept of KeyCare, as we've talked before, is I've always thought it was a really great idea that I didn't think was ever possible because, like you said, you're the first company where you're a virtual based company that has an Epic instance. Where, going back to your thought genesis of this idea, taking all that history that you've had, at what point did you kind of go, maybe this could work, well, with going with Epic, which is, for people that don't know, the largest EMR system, in the United States and growing globally.
So what happened, interestingly, was, like I said, after I sort of exited everything and I had all this experience, I was up visiting, friends, colleagues at Epic. And they were thinking about this idea. It was interesting. I went up, said, "Hey, we're in the middle of COVID. You're doing a lot of telehealth, and in fact, turned out they are doing more telehealth on Epic than any other telehealth provider in the nation, I believe. And they're doing many millions of visits a month across their system. Now, it's a combination of scheduled, some on demand, etc. And I knew their telehealth folks. I knew they were building up their functionality." Right. So from a technical perspective, I'd seen what the industry has to offer. I knew that health systems didn't necessarily like, I got a lot of feedback, they didn't necessarily like working with third parties where they just sent patients into a completely different technology system that was not integrated in any way or minimally. So I knew the interest and demand from health systems there, but Epic knew the same thing. They'd been asked for years by their health systems, hey, how might we have a virtual care partner who's more integrated? So it wasn't necessarily my idea. Epic was already thinking about it. I simply was right place, right time. I said, hey, I'm happy to help give you some advice on this. But they actually, we decided, with my experience, it made sense to work on the company. And so again, it was, I did not think I'd be going back into virtual care, but this one just made a lot of sense. And I knew there was a lot of need and opportunity. I knew, in many ways, I like to think I'm innovative, but in other ways, this is working with the grain. This is working with health systems where the majority of patients are aligned. It's working with Epic, which is the big player in the EMR space. It is figuring out how to work with insurance, which now pays for virtual care. I am going with the flow of the river in terms of how to get things done, but trying to introduce new innovative ideas and technology to make it more efficient. Because at the end of the day, if all we do is provide doctors on Epic to support other health systems on Epic, that's a good thing, and there's a business there. But what we really want to do is create these tech-empowered virtual care teams that can really scale. Because that's the only way we really impact the health systems is to learn how to scale. And what I'm focusing on are what I call the triple R threat that is drowning our doctors: routine, repeatable, rules-based care. And that's going to be much easier to automate and delegate and scale than trying to do that for the really complex care. So that's our initial focus.
Got it. No, that's cool. Let's talk a little bit more about how virtual care kind of efficiency could really be kind of that accelerator. Because you're right. I mean, you talked about the officeologist, which, that's the way medicine's been done for as long as I've been around. I mean, I remember going to see my pediatrician back in the day, and it was very much the same as the experience would be today. But I think in order to take care of our population, especially as the population is aging and having more chronic illnesses, I mean, eventually we'll hopefully prevent those chronic illnesses, but that's going to take another kind of generation to get there specifically with technology. But I think, I'd love to hear your thoughts on more about what you just said, and specifically how you see, your company and other kind of virtual care being not necessarily the answer, but one of the solutions that can help us take care of more people and with less, physical human resource.
Yeah. So I'm going to talk about two buckets, or maybe three. So bucket number one is, interestingly, we're in some ways going back to the eras before you and I practiced, Adam. We're going back to home-based care. We're going back to going to the patient's house and taking care of them like the old-style doctors used to do. And there's a benefit in that, in the sense of you're able to touch someone in their, so to speak, in their home environment, and there's something interesting to learn from that. It's certainly more convenient for the patient, and so there's some goodness to that. Bucket number two is this concept of being able, because you're virtual and online, we're able to automate more of the visit, right? By default, you've got a patient population or their proxy, right? Maybe an elder patient has a proxy, a child helping them, who can do things and prep more for the visit ahead of time, where they'll more likely do that for a virtual visit than they might for an office visit. And on top of that, we're looking at a lot of technologies that can be used online, such as you have a camera, audio, etc., analyzing the patient and using AI to do everything from detect their vital signs to diagnose certain tremors or depression or other things just by continuous video, which would be a little awkward to do maybe in the office itself. So we have the potential to start automating things. And there's three parts to automate. There's the pre-visit part. What can we capture ahead of time? Again, this is not a new concept, but it starts to become more pragmatic. There's the during the visit, which is, of course, using things like the AI GPT to essentially automate, translate the discussion that we have, and document the visit more easily. And there's after the visit, which might be some type of follow-up, etc. And then you could argue there's between the visits as well, which would be another third bucket, which would be that remote monitoring, which is going to help us a lot. So if I see a patient, instead of seeing them in the office twice a year, even 4 times a year, Now, all of a sudden, I can be tracking them, on a daily basis, using some type of early warning system if we know there's a problem. And I think virtual care is a much more amenable to team-based approach, which we know is really important and really scalable. Again, we're not inventing any ideas. We're simply executing on them more easily because of the fact that technology and virtual care makes it a lot more scalable. As a primary care doctor, I can't have a big team in my office. Just physically, there's limited space. But all of a sudden, what if we could go to a primary care doctor at a health system and say, we're going to give you a virtual care team that, hey, Dr. Smith in the office, all of a sudden, we're going to give you a team that includes Dr. Jones, includes 3 NPs, 4 MAs, et cetera. All of a sudden, you can double or triple your panel size, and Dr. Smith in the office is going to start seeing in the office a smaller number of people who really need to see him, but oversee a team that's able to manage the population based on rules and protocols that understand the difference between a routine issue and something that's more complex and needs Dr. Smith. I sat in my primary care office and often thought, I'm seeing 20 plus patients a day, but most of them I don't really need to see. Most of my job was figuring out where can I really make a difference. Many of them were just routine follow-ups, refills, get some labs, order some tests, or routine issues, sinus infections, UTIs, et cetera, that didn't necessarily need me. And there's a really important balance. I get it as a primary care doc that you want to have a relationship with the patient. You want to know when there's a problem, but our current system is not scalable. And all these people who talk about, we just need to decrease the panel sizes are living in a fantasy world. We have such access issues. We've got to do what every other industry has done and figure out how to tech enable, and team enable the most valuable people in the system, which right now are primary care doctors.
Yeah, no, that's so spot on. Obviously, I think we agree on the vast majority of things, especially in the realm of this. And I think that last comment you just made, I actually got into, I would say, a civil spat on LinkedIn with someone who was trying to say that the answer to all of our healthcare woes is, like a direct primary care model. And I said, well, I agree. As a physician, that's extremely enticing, you have a panel of 250 people that really well. They have great access to you. You're not just overwhelmed with all this stuff. But I told him, I was like, there's no way that's going to take care of our problem in healthcare. We have a lot of people that need to be seen. And, I think, and I've always stood by the notion that if we can find a way to encapsulate what it feels like as a kind of a physician or clinician on the direct primary care kind of side, but allow them to take care of 2,000, 10,000, 100,000 patients, with what you just described, tech enabled, team-based, automation. I think that is ultimately the answer, that's going to allow us to take care of the population that we have to, and frankly, help with the rampant, call it burnout, whatever you want to call the term, but it will help people get back to why we all wanted to go into medicine, for the first place and work in healthcare.
Yeah, and I think there may be, a split similar to how we split hospitalists in the 90s. I forget. I'm not sure where you were in the situation, but I was in the middle of it. I remember having to get up early and go to the hospital and round on one patient. It was horribly inefficient. And during the day, either I wasn't there for the patient or I'd have to get called out of my room. It didn't make a lot of sense. And so we created this idea of hospitalist, which is now accepted. Doesn't mean I can't call my patient to a social visit, etc. I know what's going on. I'm keeping track, but I've got someone in the hospital. And now I believe we're going to see a split of officeologists and virtualists. And there's certain doctors, who really want to be in the office, and they're going to recognize they're going to need to take care of the more complex patients in the office while overseeing some of the less complex patients outside, but trusting their team to do it. And the truth is, many other industries have done this, right? When you go to the bank, you don't see the VP of the bank if you want to withdraw $100. They've got a teller to do that. And if you want to do something more complex, you'll get to the VP. And even even in healthcare, many of the specialties have done that. Think about the last time. I mean, certainly a dentist, they've figured that out. They come in, they shake your hand, you're happy to see them, and they're only going to do the complex stuff. They're not cleaning your teeth. You go to a dermatologist, majority of the visits with someone else, or an ophthalmologist, right? You walk into 4 different rooms, 4 different people doing everything, and then the ophthalmologist comes in, shakes your hand. If you want to do LASIK, they'll be there for you, but you don't need them for everything. And years ago, I studied the concept of these practices that really took advantage of this. A doctor with multiple NPs, maybe in a more rural setting, where we call them super practices, and they could see 50, 100 plus patients a day, and do it really well because they had a system, but they need a lot of physical space. And you look at surgeons, right? You don't have a surgeon prepping the patient and doing the cleaning them and doing everything. They've got a system where the surgeon does what they do best. I mean, quite honestly, before anesthesia, your surgeon, back in the 1800s, like surgeons had to do everything, but they figured out how to do it. We are still practicing the same way, essentially, we practiced, in 800 BC, and it is time for primary care to understand there's a better way to practice in a more efficient way, because these folks who say, oh, everyone should just be in a concierge practice or DPC practice, et cetera, that's like saying, well, everyone should just get a Rolls Royce and a beautiful home. And I mean, it just physically, this isn't, possible. Mm-hmm. And it's like saying everyone should get their own personal lawyer, or some other similar type of thing. Even if you go to a law firm, right? You don't get a big law firm. You don't get the top lawyer. You get that guy plus his team who are going to take care of you, and everybody works together. And so yes, we have to learn not just from other industries, but even from other healthcare specialties, how we as primary care in particular can do this better.
Yeah, no, it's so interesting. I think about, again, kind of the integrated model I work in Kaiser. We obviously want patients to see our specialists like what you said, that truly need to be seen. And obviously the same applies for primary care. We want people to be seen there that, truly need to be seen, particularly in the office. And I think what's a challenge though with a lot of this is there's there's a cultural or a patient perspective too. I'd say it's in America, and it's probably elsewhere too, but where, if people have a sore throat, like they want to see an ENT doctor, there's this kind of notion that, I think it's probably a result of just some of the kind of PPO products that have been around for a while, where you get this like kind of ultimate choice. And I think it's tough because you want people to feel like they have choice, but you also want their issue to be taken care of in the most efficient and the most appropriate way. And by having, an effective team-based approach, we can. I mean, I'll just say anecdotally, a lot of times when I have a patient that's like, frankly, just demands to see one of the specialists, I'll refer them. But like our specialties are really good because they have different physician assistants or NPs that work with them. And so those folks will actually see the patient first, and I think it still satisfies people, but it goes back to your concept of having that kind of team-based approach, and it's worked well. You mentioned like lawyers, and I thought about it too. Like I think I have a benefit now at my work where I can sign up and I can have like this like access to law advice, and it's kind of like that. It's obviously it's a subscription, that our company gives us as a benefit, but it's very much like what you're describing. If I have a legal issue, I know I can have that resource. But to your point, I'm not going to get the top lawyer in that whole system. So I think we have to be more like that in medicine.
Yeah. I'm going to quote 2 sort of studies that I know about that have influenced me a lot. One was a number of years ago, in my innovation role, I work with Northwestern's Siegel Design Institute. And there's a great group, graduate students there who were able to do projects. And we did a project in the innovation world where it was really just about talking to folks to get a sense of putting them into different personas. And we looked at, the internet-enabled generation, sort of, 20 to 40 years old. And just wanted to understand what's their interest in understanding in personas around dealing with physicians and technology, et cetera. And what we find, and what's really important, is that, of course, there were multiple personas, but turned out to be around 5, and ranged from, I just want to see anybody who's available for, it's all about convenience, to I want to see the guy who's been educated at Harvard or the Ivy League and has the most experience and best credentials. And it wasn't quite evenly distributed. And in between there, there are a couple of other personas. But so lesson number 1. Patients are different, and certain patients are going to say, I want to see the ENT for sore throat. But a lot of patients will just say, I want to see someone, or they might say, I need to see my doctor, et cetera, for something important. And then the second study was actually more of a little anecdotal, but I don't think it was published, but it was done out of UPMC. And they looked at e-visits, asynchronous visits, done in Epic, where they told patients, for urgent care issues, would you can submit your asynchronous e-visit, and we can either give you a response in an hour from someone in the organization, or we can send it to your doctor and get a response in 24 hours. 95+% of patients said, just send it to someone. I want a response quickly. And of course, then they interviewed them, asked them afterwards, why was that? And of course, the most obvious answer was, well, I had an urgent issue. I didn't want to wait 24 hours. But it was a second answer that always stood out to me. And this was 10, 15 years ago. And they said, I do have a doctor. I love my doctor's the best doctor, right? They could handle anything. They're awesome. I love my doctor. But what I have right now is a routine issue. I don't want to bother my doctor. My doctor's really important. They need to take care of the important stuff. If I have a really big issue, I need to see my doctor. Mm-hmm. But for these minor issues, these routine issues, I'm fine just seeing someone in the system. And it really hit me strongly at that time and to this day that we don't give patients enough respect to understand that they understand the difference between a routine commoditized issue and something that is more special, complex, needs their doctor. And I saw this play out. My patients, I was only part-time primary care. I had a very loyal group of patients. And yet sometimes they would go to the pharmacy down the street to get something done. Why? Because, you were busy, doc. I couldn't get in. This was a routine issue, don't worry about it. But I get a fax maybe or maybe not know. So, I, of course, as a primary care doc, internists were the worst. We want to know everything all the time. But that influenced me a lot in understanding what patients need and want. And particularly these days, they're so busy. We want online quick care for everything. But they also understand it doesn't need to be my doctor. But the more it can be my doctor's team and the more it feels integrated, the better that works for everybody. And so that's what we're trying to bring. And that is not going to be for 100% of patients, but for a lot of patients, they're very comfortable with it. And it's actually the doctors who need to get sometimes more comfortable with it. And I recognize that when we come in and partner, that some doctors are going to say, I want to see everything. But we also say, look, you can't. You can't see everything. And wouldn't you rather them see someone who's partnered with you than to go out in the wild and see someone that isn't integrated with you at all? And that's usually where the comfort level starts.
Yeah, I love that. I think back to a time back when I had my own panel in primary care, and we were rolling out a way that our clinical pharmacists were going to help with all the refills that were coming to primary care. Mm-hmm. And just like what you just said, where there was resistance, there was a fair amount of resistance from many primary care doctors. They were like, no, I need to see those refills, because that's my trigger to know X, Y, and Z about them. And I think it took some people more time, but obviously now it's like, that's just fully automated and it's either protocol driven and approved automatically, or if that pharmacist needs to touch it, they can look a little deeper. But that's a very similar parallel to what you just described.
and when we were rolling out health things like a decade ago, we found actually majority of PCPs were pretty good as long as they knew there was a protocol that they or their group had approved, and that it would highlight when someone was was late for something. It would only give a month at a time, try and get them to come in. We had to get their trust on the protocols. There was always that one or two docs who was like, no, I need to see all the refills. But the truth is it's a non-reimbursable activity. It is, again, it's routine type of rules-based practice. And since it was delegated to their own staff, maybe they felt a little more comfortable because they knew their MA would let them know if there was an issue, or the refill nurse would highlight if there was an issue. But the truth is we've just overwhelmed our docs. So that was something most of them felt more comfortable giving up. But we would now and then face some doctors who just needed to see it all themselves. And, God bless them, but it is we do it to ourselves sometimes in terms of burnout.
Yeah, I agree. And I think before I jump to, I have several questions I want to ask you, kind of rapid fire, that are fun to finish. And I want to be respectful of your time today. But mentioned, I think, you have a couple ways that people could reach out to you or KeyCare. What's your preferred method if anybody's listening to this and wanted to potentially find out more information?
Go to our website, right? www.keycare.org. And there's ways to submit something to us. I'm also on LinkedIn and also on Twitter. So what's my Twitter's is Dr. Lyle MD, DRLYLE MD, but easy to find on all those places. I have a website as well, drlyle.com, drlyle.com. Which is if nothing else works, you can reach me there as well.
Perfect. Well, this has been a very cool conversation. I appreciate you taking time. I'd love to finish and wrap up today with what we call our Nerd Alert lightning round. And for you today, I've switched up the questions a bit that I have been asking, just because I think they're fun and interesting and they're not hard. And if there's something in here that you don't have a quick answer for, you can hit the pass button, just like on a game show. All right. You ready?
Yep.
Awesome. All right. So first one, what's the best book that you've recently read and why?
I'm reading like a half dozen books, from Hemingway, business book, etc. The Trillionaire Coach, is really interesting. I'm in the CEO hat. I'm going to do a call out, though, to a book I read a couple of years ago, but I just love so much. Was the bizarre double life of William Halsted, who was like the first real surgeon and a true medical innovator. This guy, from a physician innovator perspective, this guy in the 1800s, was one of the first to use anesthesia, figured out a variety of surgeries, etc. Great book for a doctor like us to read.
Cool. Thank you. And the theme of this show is kind of unlocking efficiency in kind of business and professional life. And we've obviously had a stronger focus on healthcare, but is there anything that in your life right now that if it was taken away from you, it would extremely affect your ability to be efficient? Can you share anything like that with the listeners?
So I'll tell you my favorite app. That will give you an idea. Perfect. Right? I'm going to see what it's called here. I forget what it's called. It is called Email Me. And all it is an app. You press it, you type out, whatever you want, like an email to yourself, and it emails to yourself. Like, how many times do you have to email to yourself and type your name in? This does that automatically for you. I know it's small, but that's the type of stuff that makes my life so much more efficient.
That's great. I love those examples, and that's such a small one-trick pony, but really does solve a real problem. What's the most interesting place you've ever visited?
Interesting. So when I was in the innovation world, I was part of a group called the Innovation Learning Network, and every 6 months we visited each other's organizations and learned something. And some of my favorite was when we went to Europe, and we did 2 European trips. One was to the UK, another one was to the Netherlands. And I probably, I love I love London in that area, and I really love that particular trip. And again, this is just geeking out, right? Where we got to go and visit some other hospitals and saw how they did things. And it just opened up another world to me about how they thought about efficiency, some ways similar, some ways different. And, from a sort of beauty perspective, I think Australia is one of the more exotic places, and being able to go through some rural towns in Australia. But from a geeking out perspective, which I know the nerds like, I love visiting other health systems and seeing how they do things.
Cool. Great example. Can you pull out any of like your historical best advice that you ever received from somebody else or someone else?
So I have a couple of quotes that I like. Right. One was a famous Louis Pasteur quote: "Chance favors the prepared mind." A lot of people are like, "Oh, did you get lucky, hard work, etc." It's such a combination of these things, and a lot of doctors are like, "Oh, how can I do what you're doing, or get into this world?" I'm like, it is. We all have opportunities that fall in front of us, and it's really important to sort of follow where the universe is going you. I often will recommend one of my favorite books is The Alchemist for people going through any type of change, and sort of accepting and going with the flow. Like I didn't predict I'd be where I'm at, and again, it's not simply luck, but it is, the prepared mind and being prepared to make a change, do something different. A lot of, a number of my early forays into business came about just, again, right place, right time, and being open to doing something different. And a lot of times it was patience. I'd have a patient come in and they'd talk about something, and all of a sudden they'd be like, "Hey, do you do this, doc?" And, I'd be working with them on something else. It's very fun to sort of see how that worked. And with that said, I try somewhat consciously to change what I'm doing about every 5 years. So even at Northwestern, they were really great to me in letting me continue to evolve and change the type of work that I did. It's not for everybody. A lot of doctors are very happy doing the same thing, and we need them to do that. For me, my journey has always been some journey of change, and just being open to trying something new. And understanding even if it doesn't work out, I'm going to learn, and it can get me to my next place.
Yeah, love that advice. Yeah, I'm definitely that same way. Resonate with you, but I think there are a lot of people that just want to be the worker bee, for whatever their job is.
We need them. We do. I need a doctor who's, we can't have doctors like us all the time. No one would say. I'm actually worried about how many doctors are going just to med school and then not even going on clinically. So there's a lot of, we do have to balance. We can't all, I realize at some point, not everyone wants to be a strategist, et cetera. And by the way, I love working. I mean, I love doing the hard work as well. And we always have to balance that. A lot of people think, "Oh, you're CEO, all you have to do is sit up and, no, it is, it's constant work, but like most doctors, I'm a workaholic, and, I'm lucky to be surrounded by people who will let me do that.
Yeah, and I think, going back to where you introduced yourself as, your background started with engineering. I mean, I think that probably plays a big role in that way too, because engineers want to fix things. And I always make this analogy that I think physicians are actually engineers in the sense of they're taking that input and they're trying to figure out the problem and solve these issues. And so I think that's probably, at least what I'm hearing is that's probably what drives you more than anything.
Yeah, we're constant problem solvers, and engineers are by definition problem solvers. Doctors in general are problem solvers. And the issue is, how much do we want to disrupt the system in solving the problem versus work within the system? And there needs to be some balance to be able to do a little of both.
Cool. All right. 2 more questions. These ones are kind of fun. What's one thing most people don't know about you?
The thing that people often like when they hear is how involved I've been in TVs and movies over the years. My dad, who was a doctor, was the doctor to the stars in the 70s and 80s, and because of that, I was actually in about a dozen movies as an extra in some various ways when I was younger. And then as a doctor, he passed it on to me. And so between myself and my dad, we took care of the majority of TV and movies in Chicago for about 50 years. And so we have lots of fun stories. One day I want to write a book or have a TV series about this, because the two of us have so many fun stories to share on that.
Oh, that's super cool. Yeah, I did not know that about you. Thanks for sharing that piece. And then the last and final question, if you could have dinner with any person, living or dead, who would it be and why?
Leonardo da Vinci. You just got to pick that guy's mind. That I've always been fascinated, right? I mean, what a forward-thinking innovator, and there's something different about how he went through and thought through things. So that's an easy one for me, because that was like my college essay. It's always been fascinated with him, and I'm sure there are many others, but that one always comes. And I was able to travel to Italy in the past couple of years and visit some of his hometowns and see some stuff there. So that was particularly fun for me.
Yeah, he was well ahead of his time back then. And you think of how people thought he was so crazy at the time. I mean, right. And I think we make parallels to some of the folks today that are thinking kind of out there, fringe. And I think a lot of times we think they're crazy too. And I always argue crazy is the way things actually change. And
the classic quote, right, is every great idea started out as a crazy idea.
Yeah.
Right. The fact that I'm doing what I'm doing is, people are like, oh, you can't work with Epic. They don't I'm like, that's not true at all. You just have to understand, how to do these things. And still what we're doing is, there's a lot to it. But yes, every great idea started out as a crazy idea. The Apple commercial, the crazy ones, right? I mean, this is, it is fun. It's tough. Sometimes you get a lot of arrows flung at you when you're trying to change the system. And yet, retrospectively, a lot of times, that's how we move forward.
Awesome. I think we'll wrap with that. But I really appreciate you taking the time on this weekend, Lyle, to chat with me officially, and look forward to further conversations. But thank you again for taking time today.
Yeah, thanks what you're doing, Em, and this is great stuff. Us, the Nerd MDs need to stick together. So I appreciate that I'm approved, and that you guys are out there highlighting that we can do better and that we can make healthcare like the best place to work again. Like that to me is really important. That we don't have to be doctors and have a crazy, tough life at the same time. We should be able to figure out how to do the right balance and get doctors at the top of their profession like others are at the top of their profession again. So I'm appreciate all you guys are doing.
No, well, thank you, and look forward to chatting with you more.
Sounds good. Take care, Adam.
Take care. Thank you for listening to Efficiency Unlocked, Nerd Tested, MD Approved, a Nerd MD's podcast by Drs. Adam Carew and Dale Gold.